Now, Ghanaian importers and traders who ply their trade in China are on high alert as the deadly coronavirus disease continues to spread. The death toll has climbed to 26 with over 800 confirmed cases in 6 countries across 3 continents. Now that has prompted Ghana's health service to issue a public alert and intensify screening of travelers at our airport. In spite of the fast spread of the disease though, in some countries, the World Health Organization says it has not reached an epidemic level. We'll speak with the WHO Ghana office shortly, but as Chinese authorities work to contain the spread, Ghana's mission in China is advising Ghanaians planning to visit the country to consider postponing their journeys. Dr. Charles Dramina is deputy head of Ghana's mission in China.
The infection started from a city called Wuhan. That's the epicenter of it, and in that particular city we have about 300 students, Ghanaian students, and then a number of Ghanaians who are also not studying but doing various, engaged in various activities. Fortunately, as we speak, no Ghanaian has been affected in this issue, but we continue to get in touch with the people, our patrons there. The embassy has reached out to the student leadership in the community. Our students are safe. They've been advised to stay indoors as much as possible, avoid unnecessary gatherings, keep hydrated, and always ensure that they have protective nose masks whenever it becomes necessary for them to go out.
Yeah, the Ghanaians who are coming to China in the next few days to do business or to do other things, what advice would you give to such persons?
Ideally, if you must travel to China, it must be on an urgent, non-extendable, or on an urgent assignment, an assignment that cannot be postponed. Then you can make it, and then when you do get in, take the necessary precautions so as to keep yourself safe. But if your trip or your business in China can't be postponed, then you are advised to do so. It's better to err on the side of caution than to get infected and then not know what to do. So we are always advising people, if your trip can be postponed, please do well to postpone it so that you can stay safe. Another point is that China is going on a Chinese New Year holiday, the lunar holiday. And this period, for about a period of 2 weeks, the place is going to be locked down. Locked down in the sense that there will be very, very little activity taking place. So as much as possible, postpone your trip to China, stay indoors, just watch and see. The fears are that the mass movement of people during this holiday period could increase the spread. And we are all a bit cautious, expecting that this thing will be under control by the time the holiday is over.
Well, the business community is also on high alert. President of the Ghana Union of Traders Association, GUTA, Dr. Joseph Obeng, told Joy Business his outfit has begun a sensitization program on the virus.
We have been discussing. You saw our members meeting, and the meeting is on how to prevent this from happening to any of our traders. This is very serious because it's also an airborne disease. But fortunately, you know, for our containers, because of the fumigation that started last year, our containers are secured from this problem. And when it comes to the entry point, that's the airport and all that, that's where maybe government have to take precaution. The Ministry of Health have to come in and take precaution by disinfecting the place on a regular basis, and also find some mechanism to scrutinize people who are coming in with the machines like the Ebola system, that to check on all this. For us, once it hasn't reached maybe an epidemic level for government to tell us not to travel, we will still be traveling. But that will also mean that some information be given to us. So we seek information from the Ghana Health Services as to what to do and what not to do like what happened during the Ebola time, so people would know that maybe you have to, you don't have to do handshake, or after that you have to clean your hands and all that. We seek those information. We are taking precaution because we have to also be careful not to even go and bring disease to this country. But we should also know that it's not only from the traders only. In the wake of the year of return, the efforts of the president, where so many foreigners are now taking Ghana as the preferred destination for tourism, and people will be coming here and all that. That's why we should even see this as a thing that we should do daily rather than an ad hoc one, that we should try, especially the disinfection, because at the ports, because of the fumigation exercise that have taken off last year, all our containers are being taken care of from these airborne related diseases. And then we think the shift should come to the airports where the human traffic is there.
Well, some of you have been sending in your comments. Do send us your thoughts also about the coronavirus. Most of you, by the way, are talking about the Achimota school. I'll read those messages. But talking about the coronavirus, we know that the number of casualties, has risen all the way from 17 to 26 in less than 24 hours. But the originating city itself, or the city from which the virus is said to have originated, Wuhan in China, has been on lockdown. There are 11 million people, about 11 million people in that particular city. How does it feel to be in such a place where you can't move out, you can't go anywhere? We have someone in Wuhan City, Esther, who should be joining us via Skype, and we'll talk to her about how they heard about, the spread of this disease in the first place, and how are they dealing with having to stay indoors for as the city is on lockdown because of this virus. Esther there, she's ready for us when we're ready to go to Wuhan. Esther comes from Wuhan and she is living there right now as this situation unfolds. Hello, Esther.
Hello.
Esther, it's good to have you on the line. By the way, Esther speaks some Chi as well. Esther, it is saying. Esther, we're really grateful that you took the time to join us here today. We'll speak some more Chi as we go along, but this is a very serious situation that you are dealing with in China. How did this all happen at the beginning? How did you hear about it?
I think it was last year. In December, I read a news about my city. They found people that were sick. And then they said it's virus. Now we know the name is coronavirus. And around that time, people, it was not that serious. And then it's only January, 2 days before it started.
So it started in December, and I believe that the authorities were looking at it in December, but we are in January now, and so far we're told that 26 people have already died.
Well, maybe, I'm not too sure, but our government are trying their best to send more those which we need here and the we need here in hand.
Okay.
And more doctors from other cities.
Do they tell you when they're going to open up the city? Because as we're talking now, everything is shut down. Nothing is happening.
Yes, they have not told us open.
So how is your day like? When you wake up in the morning, you just stay, tell us, what do you do in a day?
Watch movies, talking. Just don't sure that we are not going out.
wake up and you just watch movies and talk to your friends. You don't go out, nothing.
Yeah.
But how are people?
Especially this period is our year. We are supposed to travel or visit our friends, families, but no, it's not allowed.
This is a very important celebration for every Chinese person. This is the time of year when people are traveling. People who are outside China are traveling back home. People, you know, are meeting family, but all of that is in jeopardy. When it happened, when this happened, you say they've not told you when, how it's going to end. But how do you get food? How do you get daily supplies? What happens?
Our supermarket, yeah, we cannot go out, but the food still comes.
I think there's a sound issue there because I didn't quite hear what you said. You cannot go out, but...
And our train station and airport are closed, but the food from other cities can still come in.
Okay, so how do you get the food? You can go to a shop and get food?
Supermarket, in China, we can order food online. Then they can bring it to our home.
And when these people are bringing the food to your home, you're not afraid that any of them might be infected?
What we do now is let them put in front of the door. And then when they leave, we can bring the food in.
Wow. But even if they bring the food and the person is infected, won't the food be contaminated? Will the food be healthy?
No, because everywhere they are making sure food is safe. And also everyone, like all of us, have alcohol spray.
Wow. Well, that's pretty interesting. Do you know any of those people who have died? Do you know anybody who knows any of them?
No, I don't know. I just read the news.
Okay. How does all of this make you feel?
Okay, first I felt guilt, but as a Christian, I'm not.
As a Christian, you're not afraid?
And yes. And I believe my country, my government, everything will be solved very fast.
Okay. Esther, it's been great talking to you. I really, perhaps as the days go along, we'll be able to talk to some of your other friends or family members who would love to talk to us, share their own experiences with us. But hopefully, like you're saying, you are a Christian. Based on your faith, you believe that things will work out well. But yeah, how are you able to understand Chi, by the way, Esther?
I have a Ghanaian friend here, and also in Ghana.
Okay, I think we're having a problem with the line there, but Esther, yeah, that's it.
I have one request, and I hope that they can pray for my city and the country. Thank you.
Say that again.
I hope Ghanaians can pray for my city and country.
Okay,
especially during this.
Okay, you hope that Ghanaians will pray for your city, Wuhan, for this problem to go away, especially within this period. Esther, thank you so much. Esther Hu, she's a resident. She's actually from Wuhan. She's also a resident. They're living there. She's part of those who are on lockdown. Like she said, food comes. You just have to make an order. The food comes. They drop it at the door. Later, they go for it. Let's get to Director of the Ghana Health Service, Dr. Patrick Abuaji, who's joining us live from his office. Hello, Doc.
Hello.
Thank you very much, Dr. Abuaji.
Good afternoon.
Good afternoon, and thank you very much for your time. So, we've declared this as a public health emergency here in Ghana.
Not declared as a public health emergency, but delay. Yes, but we put in systems to sort of prevent entry or be able to surveillance to identify any threat or anybody coming from an affected country so that we are able to prevent the disease from coming into the country.
We understand that the Ghana Health Service is embarking on some sort of sensitization program. Can you run us through this? What exactly are we doing?
Yeah. Well, thank you very much. We have the Public Health Emergency Management Committee, which currently exists at the national, regional, and district level, have been alerted to be ready. Yesterday, the National Technical Committee, Coordinating Committee also met to discuss the situation and confirm measures put in by the Public Health Division and, of course, the Ghana Health Service in general.
So apart from the airport, yeah, what should Ghanaians expect?
Okay. Let me just run you through what we've done so far, and then we can get to that. It's an echo. Repeat. Yeah, we have developed a case definition because you cannot just quarantine anybody or speak to anybody. What we do is that any person who has a temperature of 38 degrees or more, has a history of fever, and having difficulty with breathing, and most difficulty breathing, cough, etc., and in the last 14 days before the symptoms has had a history of travel to China or any of the affected countries. And also, if that person, even they may not have traveled there, but has come in contact with somebody who has returned from that, that will be a case that we need to assess, make sure that we are not dealing with that condition.
So,
and like I said earlier, we have informed all the regions, the district, the teaching hospitals, etc.
Okay. I was just going to ask you about...
to be on the alert.
Okay. Yeah, I thought that you had finished, but you are on air. You are on air, Doc. I thought that you had finished, but just to be clear.
Yes, okay.
I wanted to find out whether, like we did in Ebola, you know, we had these emergency health posts of sorts, so that people who report these symptoms that you've mentioned don't necessarily go to the mainstream hospitals. Are we having any such plans?
We have sensitized all our port health staff so that they will know exactly what to do and where to refer them to. The hospitals are also ready to manage. We have spoken to the laboratory, the Noguchi Memorial Institute of Medical Research. They are also ready with the logistics to be able to test and make the diagnosis if we encounter any such case.
Okay.
And like we asked earlier, we have a clinical care plan so that they know exactly, the health workers know exactly what to do if they were to contact such a person. First is to protect themselves with the PPE. Yes, and then, of course, the necessary logistics that are needed are also made available for them. We are also develop a risk communication plan so that the necessary information is done, guidelines, media, just like we are doing, general public information, and flyers. The flyers are nearly ready to go out. We have developed some entry forms where at the ports where the forms will be completed. And then if you find that we are sort of suspect, you meet the case definition, then the necessary actions are taken. Yeah. In the last 24 hours, we've screened about 429 passengers who have coming from the affected areas on Emirates, Kenyan Airways, Ethiopian Airlines. And so far, we have not encountered any case that meet the case definition.
Okay, Doc. Because of the, the transmission and the feedback issues that you're having, and also because of time, we'll say a very big thanks to you. But we'll talk to you more. Yeah, we'll talk to you more in your office, and then we'll get some more to share with the Ghanaian public who are very eager about what we're doing on this. Doc, thank you very much. That is Dr. Abwaje there. He's the director of the Ghana Health Service. Well, I do have some messages here as we wrap up and do some sports. This is from Botuo from Subin Ameyao. He says Ghana as a country should extend our prevention teachings widely since the disease is easily contagious. Thanks for your programs. Thank you very much. This one also says, Farouk from Tamale North wants to find out what measures government is putting in place to safeguard Ghanaians who live in the affected area. We'll bring you an update on that as and when we know.